So welcome to the first Hemophilia Council of California webinar for 2023. Thanks, Chair, for that introduction. Like I said, we're thrilled to have you on board. So I'm going to let you keep rolling, and we're going to jump right into some updates in terms of the state budget and legislative advocacy for this year.
Perfect. So the budget this year is not so great. We have a $22.5 billion shortfall. Now, normally that would be really, really bad news, but we do have billions in reserves. So it's not as bad as it could be. It's not as great as it could be either. So in past, when we had really great budget surpluses year after year, you would read the budget very excitedly to see like what new funding did we get in this program and this program, and that's not the budget that we got this year. On the other hand, it's also not like the budget shortfall, budget deficit years of past either, because generally you would read the budget very shakily and very nervously, right? Because there were going to be cuts after cuts and after cuts. And oh gosh, don't let those cuts happen to us. And that didn't happen either because of those billions in budget reserves. So what did the governor decide to do with that $22.5 billion shortfall? He decided, well, what we're going to do is we're going to delay a lot of the funding that was passed in last year's budget for new programs, and we're simply going to delay funding those new programs. And that is how he's trying to address the budget shortfall so far. We'll know a lot more when the April tax receipts come in, and then we have what's called the May revision, where the governor revises his budget proposal of January based on those tax receipts. And in the May revision, we'll have a clearer understanding. Did things turn around? Are they worse than what we were thinking they were going to be? Are they going to be better than we thought? Even if it's bad, the governor would like to just address the budget shortfall by delaying spending for the new programs that were passed last year, mainly in the area of climate action. And then if that doesn't do the trick, then utilizing budget reserves. He's really going to try and not make cuts to programs. So cross your fingers that things don't turn out as bad as it could be in May, and we will hopefully avoid any major cuts to programs. Right now, as of where we stand right now, the governor is not projecting that we will have a recession. And even he uses the term mild recession in his budget. So cross your fingers that we don't go into a recession, because that's really going to be a big part of whether we see steep cuts in the future, as if we nosedive into a recession. Lynn, you want me to start talking about specific spending proposals that we have? Okay.
Yeah, that'd be great.
So again, it's not a very exciting budget where we can look at like, oh, all these new programs are going to be funded. It wasn't a lot of that. But there were some things that I could pull out that you guys might find interesting. One was the California's Behavioral Health Community-Based Continuum Demonstration. Wow. Try to say that 3 times fast, right? I had a hard time when I was reading it, but it's $6.1 billion over 5 years between DHCS, the Department of Healthcare Services, which oversees the Medi-Cal program, and the Department of Social Services. And it's really going to try and fund these continuum programs to target at-risk youth, homelessness, people with emotional disturbances and substance abuse problems, and serious mental illness, and then justice involved youth. And the whole point of this is to try and provide that continuum of care for behavioral and emotional health that we haven't really seen the state do a very good job of in the past. And so that's what that project is going to be. So there is significant funding for that project, which is very good news. There's going to be funding from the opioid settlement funds for opioid and fentanyl response, where they're going to take like $93 million and do it in a variety of ways to try and combat the opioid and fentanyl epidemic that we're experiencing. And then there's a very exciting project that we don't know anything about. The governor is not giving any sort of details, but it's called the Health and Human Services Innovation Accelerator Initiative. And we don't know how much they're going to be spending on it. The governor says that we'll know more about this program in the coming months and definitely by the May revise. But essentially, it would be a new entity within state government with seed funding, in which California is going to be looking at the greatest, and I put greatest in quotation marks because these are the governor's budget proposal words, the greatest threats, the greatest health challenges that threaten Californians today. And so one of those is, for example, diabetes epidemic in California. There were a number of others like senior health. There were a number of others that they mentioned could possibly be part of this program. Don't know much more about it than that, but I'm excited to learn more details because we could obviously advocate for the governor to include rare diseases as part of that accelerator program, right? So that could be something that we could do as HCC. A few more things, home and community-based service spending plan. I know that's something that is important to many people within HCC. There was a number of proposals last year in the budget, in the 2021 Budget Act, that made funding from the American Rescue Plan available into 26 initiatives across 6 HHS departments within California. So that could be like Department of Public Health, Department of Aging, Department of Healthcare Services. And the budget unfortunately includes a $60 million reduction to the previous budget funding for that. But there's hope that perhaps that the legislature will not entertain this $60 million reduction in funding and maybe pushes for just a delay in funding. But that program, which was so exciting to help people stay in their homes and have community-based services, that has a $60 million proposed reduction in funding. So we'll be keeping an eye on that. And then of course, there's also funding towards the SMARTER plan, which is the governor's COVID response, although the governor does indicate in his budget because of the public health emergency winding down, that there will not be the previous amount, the previous volume of spending on COVID-19 response in the future as there has been in the past. But he still reflects $176 million in COVID-19 response.
All right, thanks everyone.